Hello, my name is Dr.Relaxa. How are you?
Relax.
Excellent. I hear you're a new patient. Fantastic. I'm just going to get some information for you to get the appointment started, okay?
Help you.
Just track down your appointment here really quickly.
Listen to those pages turn.
All right, here we are. And can I just grab your name? And your date of birth? Perfect. And your address? Okay. And your brief medical history. Excellent. Great, great. Oh, what's that? You've never had a cranial nerve exam before?
Relax.
Absolutely. I can give you a little taste of what it is, okay? A full cranial nerve exam assesses 12 cranial nerves, each with a specific function related to sensory and motor pathways. This exam involves testing visual acuity, pupil responses, eye movement, facial expressions, and movements, as well as hearing, swallowing, shoulders, and neck, okay? This comprehensive assessment provides a valuable insights into the functions of the cranial nerves and help identify any potential neurological defects, okay? So we'll get started. Now, to start every appointment, I always start with checking your breathing here, okay? So I'm just gonna... All right, I'm just gonna put this on your back, okay? I'm just gonna have you have it. Take a deep breath in for me, okay? And take a deep breath.
Relaxation.
And just on the other side here. And just once more. And once more on this side. Perfect. Everything sounds good with your lungs there, as well as your heart.
Wonderful dreams.
All right, so to get started with the cranial nerves, we're going to start with the olfactory senses, which is basically the smell detection, okay? So we're going to start with 5 right here, scents. Each one has a different scent. On the scent is a picture of what the scent is, okay? So we're going to start with the first one here.
Whisper.
And what does this smell like? Robots, yes, you're correct. Good job. And what does this one smell like? That's right, a wolf. Great job. And the next one here.
Go to sleep.
And what does this one smell like? Surprisingly, you got that. Yes, goblins. Good job. This next one here.
Relax.
And what does this one smell like? That is correct. A horse. Yes, good job. And the last one here.
Tingle.
And give that a sniff.
Tingle.
What does that smell like?
Tingle.
That is correct. Birds. Good job. Well, you got all those
Tingles.
perfect. So your olfactory nerve seems to be in excellent working condition. All right, next we have the optic nerve. This one tests with, we're going to use an eye chart, and we are going to use a lighting tool as well to demonstrate how your pupils dilate as well as how they function when regards to light, okay? So we're just going to start at the top right here. Can you tell me this letter right here? Perfect. Now this letter. Great. This letter here. Awesome. And I'll just point and you just keep telling me just like that. Excellent. Perfect. Good job. Great. Yes. Great eyesight. Yep, this one.
Dr.Relaxa will lull.
This one. And can you tell me what color this line is here? That is correct, green. And what about this one up here? Excellent. And what about this one down right here? That is correct. And can you read this line for me as well?
Sweet
Great.
dreams.
Fantastic.
Sweet
Yes.
dreams.
Great. Awesome. And can you read any of this line here? Phenomenal. What about this line here? Excellent. And the last line. Well, oh my, you have 20/10 vision. I am blown away by that. Okay. Next, let's see how you do with the light test here. Okay. So I'm going to use this pen here, and I want you to focus just on my finger. Focus on my finger right here. Don't get distracted by the light, okay? No matter what, don't get distracted by the light. Focus on my finger. Focus on the tip top of my finger there. Don't get distracted by the light. Okay? Don't get distracted. Don't get distracted. Good, 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 good. Perfect. Okay. Now do reverse. Focus on the light, but don't look at the finger. Focus on the light. Follow the light, but don't look at my finger. No matter what, don't look at that finger. Don't look at it at all. Perfect, perfect. Okay, great job. Great job. Okay, everything looks great with your eyes for the light exam. Okay, so we're going to move along to the ocular motor, the trochlear, and the abductions, okay? So what I'm going to be doing is we're going to follow this pen, and I'm going to be making it in the shape of an H, and I just want you to follow along with your eyes. Don't move your head, though. Follow just with your eyes, okay? Don't move that head. Perfect. Okay, and now follow with your eyes here. The H, just so I can get a clear look at each of these nerves within your eyes. Judging from how they move, sorry, I can't make an H. Here we go. Perfect, yes.
Help with sleep.
Okay, that looks okay.
Help with anxiety.
Perfect, okay. Good, good, good.
With
okay.
insomnia.
Everything looks good with your eyes there.
And a wide.
Everything looks fine with those, okay? But next we're going to do it the same thing with light through color, okay? I'm going to be making the H shape. And I want to see how your eyes respond to each color, okay? See if there's any deficiencies I should be looking for at all, okay? Follow that H. Follow that H shape, okay? Perfect. And we're just going to switch up the colors now.
Relaxation.
Okay, and follow that H shape as well, okay? Perfect. Perfect, okay? Excellent. Okay, looks good with that one. And now we're going to use it, same thing again, with this color here. It's a bit brighter. Follow that H. Follow that H while I look at the nerves here in your eye. Ocular motor looks good.
To wash over.
Tracheal. No, that looks okay too. Perfect, okay? And then the abductions.
Relaxation.
Abductions.
Your evening.
Not sure exactly how to say that.
Morning or afternoon.
They don't exactly go through grammar with you in the school. Okay. And here we go. Follow the H for the last color here. It's more of a darker shade here. Okay. Follow that. Excellent. Follow that H shape. Perfect. All those nerves look fantastic. They seem to be working properly and just what they are required to do for their functions. Okay. So we're just going to move along now to the next one. The next one is we're going to be doing is the trigeminal nerve, okay? And this one focuses on touch sensation. We'll be doing some pokes on the forehead for some soft and dull, as well as the jaw and the cheeks, okay? To see how they react. Okay, so I'm just going to have you close your eyes for me and tell me if this is soft or dull, okay? Okay, and this one. Perfect, this one. Perfect, this one. This one. What does that feel? What does that feel like? That's soft or dull, sharp or dull, sharp or dull, sharp or dull. Good, good. Okay, and now we're just going to move on to just your cheeks as well, okay? So you tell me if it's sharp or dull, okay? The sensation here, okay? Sharp or dull, okay? Sharp or dull, sharp or dull, sharp or dull, sharp or dull, okay? And I'm just going to move to the other cheek here as well. Sharp or dull, Sharper, dull. Sharper, dull. Okay, perfect. Sharper, dull. Excellent. Okay. And now we're just going to move on to the chin area. Okay. And so tell me, is this sharp or dull? Sharp or dull? Sharp or dull? Good. Good. Sharp or dull? Okay.
Relax.
Sharp or dull? Okay. Perfect. Excellent. Good. Good. Okay. Perfect. Okay. And you seem to have gotten most sensations for those correct. So it seems like everything's working well for that nerve as well. Oh, also with the trigeminal nerve, we also want to make sure that the jaw is in working order. So can I just get you to clench your jaw for me, okay? Perfect, good, good. And now just move it from side to side, okay? You're having no issue with that? Just like that? No movement issues there, okay? And I'm just going to try and move your jaw as well. Perfect. Okay, everything seems to be good there. I felt nothing under the jawline here or anything to worry about. So everything looks good with that nerve. It's working. So we'll move on to the next one now, which is a lot like the one we just did. So this one is the facial expression nerves, okay? So I'm just going to get you to start just by puffing out your cheeks. Put all the air you can in your cheeks and puff them up as much as you can. Perfect, perfect. Do you feel any sensations or pains or anything like that? No? Okay, excellent. Now I'm just going to get you to do different types of facial expressions for me, okay? I'm just going to get you to smile real bright for me. Big, wide smile. Perfect. And just give me a frown real quick. Okay, excellent. Now just give me a wide-eyed with eyebrows expressed up as well. Perfect. Everything looks good there. Okay. Okay. I'm just going to... Everything looks good there. Eyebrows. Okay. Excellent. And the last thing is we will do a close eye resistance. So what I'm going to have you do is close your eyelids, and I'm just going to try and open them. And I just want you to stop with all your force with your eyelids. Stop me from opening them, okay? So close your eyes. All right, I'm going to try and lift them. Perfect. Don't let me lift them. Good, good. Perfect. Everything looks good with that too. Everything looks greased with the facial expressions and muscles as well. So that nerve is perfect. We'll move on to the next one. And the next one will be the vestibular nerve, okay? And that will be focusing on the hearing. So what I'm going to be doing is whispering into each ear, okay? And just repeat back to me what you hear. Tingles, 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 tingles. Excellent. Relax, 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 relax. Excellent. Stipple, 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 stipple. Perfect. ASMR. Great. Yes, everything seems to be good with that as well. You had no issues there at all? You don't feel any pain in the ears either? You don't find it hard to hear? You don't feel flinched almost? No? Okay, perfect. Then we'll be able to move on to the next one. The next ones we'll be moving on to is the glossophil and vagus nerves, okay? Which is basically the palate evaluation of your tongue as well as the gag reflex, okay? So we'll get started with that. We're going to start with the gag reflex. I'm just going to use this sterilized instrument here. And if you'll just open your mouth and stick out your tongue wide, okay? Perfect, okay? Okay. Everything looks good there. Dr.Relaxa. Okay, perfect. Is here to help you. And there's no pain or anything like that? Help with sleep. Fantastic, okay. Help with anxiety. Now for the next one here, we're just going to grab my little help with insomnia taste tester here. And a wide range. And I'm just going to get spray one of our flavors here just on your tongue just to evaluate your palate, okay? Now, do you find you have any problems with tastes or anything like that? No? Okay. Let's give this a try. Just stick out your tongue there. And what does that taste like? Breathe in. Perfect. Spot on. Just stick out your tongue there. And what does that taste like? Perfect. Spot on. Great job. Okay. And that will bring us to the spinal accessory nerve, okay? And that one, I'm basically going to be kind of like I was doing with the jaw, but your entire head, I want you to look straight forward and don't resist me pulling your head in any direction, okay? I'm just going to get you to do that right now. I'm going to attempt to pull up here.
Over you.
Good, perfect. And we're going to go down here.
Allow
Okay, and then we're going to go this side.
relaxation.
Good, resistance. This side here, excellent.
Into your
Okay, and I'm just going to grab just the cradle the sides of your face. I'm going to do the same thing here. Okay, no, resistance, that's perfect. Okay, excellent. Okay, now next, we're just going to be doing it on the shoulders. I'm going to be getting you to just shrug and keep your shoulders nice and perked up. Go as high as you can with them, and I'm going to try and push down, okay? And you try to push with all resistance to keep them down, to keep them up, okay? Here we go. Push. Excellent. Push.
Relax.
Excellent. One more time. Perfect. Everything seems good there. A lot of good resistance with all those, so I think those nerves are perfect. And now we'll move on to the very last nerve, okay? Which is the hypoglossal nerve, okay? And this one will be mostly involved with the tongue and the movements of the tongue, okay? So a lot like the other ones we were doing, I'm going to get you just to stick out your tongue and move it from side to side, up and down, okay? And I'm just going to take a look with my little light, handy pen light here, because I'm also going to be looking for symmetry on the tongue as well, okay? Just to make sure everything's growing properly for that. Okay? And perfect. And put your tongue to the left now. Okay, and now to the right. Good, good. Now just up. And just put it down. And now just wiggle your tongue around. Perfect. Everything looks good with that. It seems like everything went great for your first cranial nerve exam. How did you enjoy it? Oh, I'm glad to hear. Absolutely. Well, I can't wait to have you in for another appointment. Take care. Bye.